this is a 45-year-old male with diagnosis of ARDS due to aspiration pneumonia, and he is on pressure support ventilation. And here you can see the peak pressure is 16 and PEEP is 5. So let's suppose his peak pressure rises suddenly to 40 mmHg and saturation falls to, let's suppose, 70, like that. So what will be your first step when peak pressure rises? So in that case you have to check for plateau pressure. So for checking plateau pressure you have to do inspiratory hold. So inspiratory hold for 1 second, and here you can see this peak pressure is about 16 mmHg and PEEP is about 5 mmHg. You can see this is the baseline PEEP, and here this much is PEEP and this is peak pressure. So if you do inspiratory hold for 1 second, then what happens that you see the graph falls like that and plateaus like that. That is called plateau pressure. So you have to assess plateau pressure if the peak pressure rises suddenly. Why do we have to assess plateau pressure? This is because if plateau pressure is normal or increased, then the management will be different. Let's suppose peak pressure is raised but plateau pressure is normal. It means that there is problem in the resistance. So resistance may be either in the endotracheal tube or in the bronchus, maybe due to bronchospasm or due to mucus plugging or due to external compressions. Might be that mainly the problem will be the resistance. But let's suppose the plateau pressure is increased. If the plateau pressure is increased, it means the problem is the compliance of the lung. So the compliance problem can be due to either intraparenchymal cause due to ARDS, increasing ARDS, or alveolar hemorrhage, fluid in the alveoli that leads to decreased compliance, or intrathoracic causes like pneumothorax, okay, or maybe due to extrathoracic causes like tense ascites pushing diaphragm upwards. So in those cases compliance decreases. So it means plateau pressure is the function of compliance, and peak pressure with the normal plateau pressure means the problem which is the resistance.